Well, I started out as an obstetrician gynecologist, as we all do, those of us that work in this field. And then certain things happened that sort of steered me towards the field of reproduction per se. There have been so many turning points in IVF. IVF really didn't start until we were able to retrieve eggs, until we were able to grow more than one egg in a woman's body. So the development of the hormones that I worked on in Sweden in the 1960s enabled us to grow the eggs. That was the hormone FSH. Then we, at the same time, were developing laparoscopy, and I was one of the 3 physicians who introduced laparoscopy into Canada. So then we had both parts of the equation in order to grow and remove eggs. The third part of the equation was Patrick Steptoe and Bob Edwards, the 2 men who started IVF, and they were both good friends of mine, and it was because of their work that we were able to start doing IVF. So we had a laparoscope, we had the drugs that we could grow the eggs with, and we started doing laparoscopy and then egg retrievals in Canada in 1981. Beyond that, there were so many other highlights in the development of IVF, the laboratory procedures that we've developed in order to grow the embryos to the state we can now. Now the genetic testing of the embryos. So our success rates have gone from the 20% dream pregnancy rates in the early 80s to 70% in the 2017. I'm very proud of the way that things have evolved at Olive, and what makes me most happy is the staff that we've accumulated that all work together to make the best outcome for the patient. And as a result, we have among the highest pregnancy rates in the country, and that leads to us becoming the flagship of the country. So people come to visit from all over the world, people come from other clinics to see how we do things. In all the years that I've been doing IVF, I've had the opportunity to see so many people have children. And we always feel wonderful when we hear that someone's pregnant and when somebody delivers. But I've coached basketball teams with 3 of my IVF children on the same basketball team. I've coached baseball with some of my IVF children. I've seen my IVF children graduate. What could be more rewarding?